My name is Sara Webb. I'm a nurse practitioner in the College of Nursing, and I worked on implementing a routine screening program for postpartum post-traumatic stress disorder. And post-traumatic stress disorder, or PTSD, can develop following any traumatic event, including traumatic childbirth experiences. And PTSD, specifically from birth trauma, is actually quite common. It happens in up to 5.8% of low-risk samples and 19% of high-risk samples. And if it's not treated, it can have pretty significant effects. It can lower overall quality of life, impair maternal-infant bonding, cause maternal isolation at a time when women are already at a high risk for isolation, have a negative impact on future pregnancies, and increase the risk of suicide. And despite the fact that it's pretty common and has these significant effects, it's not currently routinely screened for or treated. Most women's health practices screen for postpartum depression, but not for postpartum anxiety or postpartum PTSD. So for this screening program, I worked with a women's health practice in suburban Salt Lake City that had 7 clinics and 16 certified nurse midwives. Prior to implementing this program, I surveyed the providers to determine how much they knew about postpartum PTSD, including symptoms, diagnostic criteria, and treatments. And I surveyed their willingness to implement a screening and referral program. I then developed an education session and presented it in a provider meeting to address knowledge gaps that had come up on the pre-survey. And then we implemented the screening and referral program by giving the patients the City Birth Trauma Scale at their 2 and 6 week postpartum visits. And the City Birth Trauma Scale is in the middle of the poster, and it is a relatively new scale, but it assesses the symptoms of PTSD specific to birth trauma. And then after the screening program was over, we surveyed the providers again to remeasure their knowledge about postpartum PTSD and their willingness to implement the screening and referral program. So the results were that I had 11 midwives complete the pre-survey, 10 attended the training, and then after the screening program period was over, I had 10 complete the post-survey. There were 8 matched pre- and post-intervention surveys. What I saw was significant increases in several measures. This included the provider confidence in diagnosing postpartum PTSD and in discussing those symptoms with patients, knowing when and how to refer patients with a positive screening, confidence in collaborating with a psychiatric provider, and confidence that patients could receive needed treatment. I am a psychiatric nurse practitioner and I was embedded in women's health, and so I was the provider that patients were referred to if they screened positive. The screening period itself lasted from November 11th, 2019 to January 17th, 2020. During that time, there were 145 patient appointments eligible for the screening, and 77 of them received it, so about 53%. Of those that did receive the screening, 18 patients, or about 23%, screened positive. 9 accepted the referral for a psychiatric evaluation, and 9 declined. The most common reason that was cited for declining the referral is that women didn't feel like their symptoms were severe enough, or they felt like their symptoms were improving. Noted barriers to the screening included a lack of a Spanish language screening tool. This is a relatively new tool and it hasn't been translated yet. And then just difficulty remembering to integrate it into the current workflow. So in conclusion, midwives in this women's health practice strongly believe in the importance of screening for postpartum PTSD. Several of them had noted that this was a gap. They had noted that women had traumatic birth experiences and that it had really significant negative impacts on them and then future pregnancies. And they were excited to implement this screening. And it can be successfully implemented as long as the key barriers are addressed. And then also educating certified nurse midwives about the symptoms, diagnostic criteria, and effects of postpartum PTSD resulted in significant increases in their confidence when addressing these areas with patients. So even if patients didn't get referred or declined the referral, the providers were much more confident in helping their patients with their symptoms of postpartum PTSD. Thank you.